You woke up with a sharp, burning pain wrapping around your ribs or shoulder blade. You think you pulled a muscle at the gym, or maybe got a weird bug bite. But 3 days later, the pain is worse, and your skin is strangely sensitive to the touch. What if I told you that misdiagnosing this pain could trap you in months of nerve agony? Today, we are exposing. This video is for educational purposes only. Shingles is a serious viral nerve infection. Antiviral medications are most effective if started within 72 hours of the rash appearing. If you experience pain or a rash anywhere near your eye, go to the emergency room or an ophthalmologist immediately, as shingles in the eye can cause permanent blindness. Now, if you are sitting there right now wondering, why does this hurt so much, and why does it feel so strange? I want you to know something important. You are not imagining it. You are not being dramatic. And you are definitely not the only person who has mistaken this for something far more ordinary. That is exactly why shingles is so dangerous in its early stage. Before the rash appears, it can masquerade as almost anything. A strained back muscle, a pinched nerve, a bad sleep position, a kidney issue, even chest pain that makes people fear their heart. In the beginning, shingles is the great mimicker. It whispers before it screams. The reason it feels so confusing is because shingles does not start on the skin. It starts in the nervous system. And that changes everything. If you had chickenpox as a child, the virus did not truly disappear. It went quiet. It stayed hidden in a nerve cluster near your spine called the dorsal root ganglion. Think of it like a sleeper cell sitting inside the wiring of your body, waiting for the right moment to wake up. That is why the pain can feel so deep, so sharp, and so specific. This is not a surface problem at first. It is a nerve problem first. And when that virus wakes up, it doesn't spread randomly. It follows a path. It travels down one nerve fiber toward one specific area of skin, often on only one side of the body. That path is called a dermatome. This is why the pain can feel like a thin, electric band wrapping around the ribs, running across the back, climbing up the neck, or stinging near the shoulder blade. People often say it feels like fire under the skin, or like their skin has become too raw for clothing. That is not an exaggeration. That is nerve inflammation. In other words, the pain is happening before the rash because the virus is irritating the nerve before it fully declares itself on the surface. So if you are in that confusing window right now, I want to slow this down and say it clearly. One-sided burning pain that feels strange, electric, or hypersensitive should never be brushed off too quickly. Especially if it gets worse over a few days instead of better. That early warning phase matters because shingles is time-sensitive. The earlier it is recognized, the sooner you can get the right medical care, protect the nerve, and reduce the risk of long-term pain later. In the next section, I am going to show you exactly why this pain happens before the rash, and how to recognize the pattern before it becomes impossible to ignore. The first signs can feel small. A twinge, a burn, a strange tenderness. But with shingles, those little signals matter. And when your body is sending that kind of one-sided nerve warning, the safest thing you can do is take it seriously, pay attention, and move quickly. Now let us talk about the part that confuses people the most. The pain comes first, not the rash. The pain. And that is exactly why shingles gets missed so often in the beginning. People are waiting for a skin problem, but what is actually happening is a nerve problem underneath the skin. Current clinical guidance describes shingles as pain, itching, or tingling in the area where the rash will develop, and those symptoms can begin before the rash shows up. So if you are thinking, this doesn't look like a rash yet, so it cannot be shingles, I want to gently challenge that. In many cases, the body is already sounding the alarm before the skin ever changes color. That is the invisible fire. Here is the biology in plain English. If you had chickenpox as a child, the Varicella-Zoster virus did not vanish from your body forever. It went dormant in nerve tissue near the spine, especially the sensory nerve ganglia. When it reactivates, it inflames those nerves and follows a specific nerve pathway toward the skin. That is why shingles tends to show up in a band-like pattern in one region, often on one side of the body. This is not random discomfort. This is a virus waking up in the body's wiring. That is why the sensation feels so strange, People do not usually describe shingles as a simple ache. They say burning, stabbing, electric, crawling, raw, sometimes even a light touch from a shirt, bra strap, seatbelt, or bedsheet feels painful. That kind of touch sensitivity is one of the classic early clues. The skin may look normal, but the nerve is already irritated, and irritated nerves can turn ordinary sensation into pain. And that is what makes shingles feel so unfair. Nothing obvious may be visible yet, but your nervous system already knows something is wrong. This is also why people mistake it for a pulled muscle or a pinched nerve. The pain can sit deep in the back, around the ribs, over the shoulder blade, or up into the neck, and it often stays stubbornly on one side. Clinical references note that shingles rash usually appears in one or two adjacent dermatomes and usually does not cross the body's midline. That same one-sided pattern is often hinted at before the rash appears. So when someone says, "It feels like something is wrapping around my ribs," or "It burns in one exact strip," that is not a throwaway symptom. That pattern matters. For some people, the early phase also comes with fatigue, a low-grade headache, or an overall, off feeling before the rash ever appears. That is part of why shingles can feel so deceptive. It does not always announce itself with a dramatic skin eruption at the beginning. Sometimes it starts like a vague illness, then sharpens into a very specific nerve pain. And because the nerve is the first target, waiting for the skin to prove it can cost valuable time. So here is the takeaway from this chapter. The pain before the rash is not imaginary, and it is not just in your head. It is often the first clue that the Varicella-Zoster virus has reawakened in a nerve and is moving along a specific pathway toward the skin. That is why the experience can feel like invisible fire under the surface. In the next chapter, I am going to show you the warning signs that make shingles stand out from a simple strain, and why the first visible bump is the moment you need to move fast. The pain is the message. The rash is the confirmation. And when the body sends a one-sided nerve warning like this, the safest response is to take it seriously right away. Now let us get practical, because this is where people either catch shingles early or miss it completely. The biggest clue is the pattern. Shingles usually shows up on one side of the body or face, often in a band-like strip, because the virus travels along a specific nerve pathway rather than spreading randomly across the skin. That is why the pain may feel narrow, precise, and strangely, mapped to one area. So when someone says, "It is only on my left ribs," or "It is just under one shoulder blade," that detail matters. One-sided pain is not proof by itself, but it is one of the strongest early clues that this is more than a simple muscle strain. The next clue is what the pain feels like. People with shingles often describe burning, shooting, tingling, itching, numbness, or intense sensitivity in the affected area. Some say even a shirt, bedsheet, or light breeze feels unbearable. That extreme touch sensitivity is one of the classic early warning signs, and it can happen before any skin changes are obvious. This is why shingles can feel so bizarre. The skin may look almost normal at first, but the nerve underneath is already irritated. That is the reason ordinary contact starts feeling painful, and why people keep thinking, this cannot just be a pulled muscle. There may also be early whole body clues. Some people feel tired, run down, achy, or develop a mild headache, fever, chills, or an upset stomach. The body can seem as though it is coming down with something vague, while the real problem is already moving through a nerve. That is what makes the prodromal phase so deceptive. It does not always arrive with a loud announcement. Sometimes it arrives as a subtle, one-sided burn plus a general sense that something is off. And that can be the difference between early treatment and unnecessary suffering. Now here is the window that matters. If the first red bumps appear, that is the moment to contact a doctor as soon as possible. The CDC notes that treatment is most effective within 72 hours of symptom onset, and their guidance lists acyclovir, valacyclovir, and famciclovir as the preferred antiviral medicines for initial treatment. Early treatment helps shorten the illness and can help limit severe pain and eye complications. So do not sit and wait to see what happens. If the pattern already looks suspicious, the earlier shingles is recognized, the better the chance of calming the virus before it creates more nerve irritation. Here is the simple clinical takeaway. One-sided burning, tingling, or electric pain. Skin that feels too sensitive for clothing. A vague tired, flu-like feeling. And then a rash that starts in the same area. That pattern should make shingles rise to the top of the list. Shingles often starts before the skin changes, so the pain is not in your head. It is the nervous system waving the red flag. In the next chapter, I am going to explain the real danger after the rash, and why some people are left with long-lasting nerve pain even after the skin looks healed. When the pain stays one-sided and the skin becomes unusually sensitive, the body is often giving you a very specific warning. Catching that pattern early is how you protect both your comfort and your nerves. Now we need to talk about the part of shingles that people fear most. The pain that refuses to leave. Even after the rash fades, some people are left with ongoing nerve pain called post-herpetic neuralgia, or PHN. It is the most common complication of shingles, and it can last for months or even years after the rash is gone. The pain usually stays in the same area where the shingles rash appeared. That is why shingles is not just a skin condition. It is a nerve condition with a long tail. And for some people, that tail becomes a daily battle. What causes that? In plain English, the virus does not simply leave and let the nerve go back to normal right away. Shingles produces acute tissue and neural injury, and PHN reflects persistent neural injury after the skin has healed. Research on the mechanisms of shingles pain and PHN has also described damage to sensory nerve fibers, including loss of axons and myelin in the affected pathway. So when people say, the rash is gone, but the pain is still here, that is not exaggeration. That is the nervous system telling the truth about what happened beneath the skin. And I want to say this very carefully. Once shingles becomes PHN, the goal is no longer just to calm the skin. The goal is to calm the nerve, reduce inflammation, and support recovery in the tissue that was injured. That is why early antiviral treatment matters so much in the first place. The CDC says treatment is most effective within 72 hours of symptom onset, and early treatment helps reduce the risk of progressive complications. This is also why people who wait and hope it will just pass can end up paying for that delay with much longer nerve pain later. And there is one more thing you need to know. The fluid in the shingles blisters can spread the Varicella-Zoster virus to people who have never had chickenpox or the vaccine, and those people would develop chickenpox, not shingles. The CDC notes that the virus spreads through direct contact with the fluid from the blisters. That is why the rash area should be kept covered, and why touching it is a bad idea. So please hear this clearly. Do not touch the rash. Keep it clean, covered, and away from people who may be vulnerable, especially anyone without chickenpox immunity. Now, about a premium nerve support protocol. I want to be precise here. Supplements are not a replacement for antivirals or medical care, and no botanical or nutrient formula can be presented as a cure for PHN. But in a supportive role, some people look for a nerve-focused protocol that emphasizes antioxidant and nutritional support while their doctor manages the medical side of shingles. The idea is to support the injured nerve environment, not to pretend the virus was never there. So if someone is considering a product like a premium nerve support protocol, the safest framing is this. It may be a supportive adjunct, not the main treatment. The main treatment is still medical evaluation, antivirals when indicated, and clinician-guided pain control. And that brings us to the final takeaway. If shingles has left the nerve angry, the mission is to calm the nerve, protect the tissue, and keep moving forward with the right care. When the pain outlives the rash, the nerve is still asking for help. The smartest response is not panic. It is prompt medical care, careful protection, and a calm plan that supports recovery. Let us bring this home with one simple truth. Your body often tells you what is happening before the full picture becomes visible. With shingles, that early signal is usually one-sided burning, tingling, or deep skin sensitivity that does not behave like a normal muscle strain. So if you remember nothing else from this masterclass, remember this. Listen to the warning before the rash steals the conversation. Do not dismiss a strange, electric pain on one side of the body just because the skin still looks normal. The prodromal phase is real. The nerve can be inflamed before the rash appears. And when you recognize that pattern early, you give yourself the best chance to get evaluated quickly, start the right treatment, and reduce the risk of a longer nerve pain story later. So here is the grounded, practical takeaway. If your pain is one-sided, strange, burning, hypersensitive, or moving in a band across the ribs, back, neck, or shoulder blade, pay attention. If red bumps appear, seek medical care quickly. If the rash is near the eye, that is an urgent eye emergency. And if the pain lingers after the skin heals, that may be post-herpetic neuralgia, which deserves real medical attention, not dismissal. And if you are also looking for supportive nerve recovery strategies, use them as support only. The core treatment still belongs in the hands of a qualified clinician, because shingles is not something to guess about. It is something to respond to. Check the link in the description for the premium nerve regeneration blueprint. And remember, the goal is not fear. The goal is timing. Catch it early, treat it properly, and give your nerves the best possible chance to recover. You are not overreacting when the pain feels wrong. You are noticing what matters. And sometimes, noticing early is exactly what protects you from months of unnecessary suffering. This video is for educational purposes only and is not a substitute for medical advice, diagnosis, or treatment. If you think you may have shingles, especially if you have eye pain, facial symptoms, a weakened immune system, or severe or rapidly worsening pain, seek prompt medical care. Early evaluation and antiviral treatment can matter. Listen to your body's early warnings. Don't ignore one-sided nerve pain. Get evaluated quickly, protect your nerves, and reclaim your comfort.